Thank you once again for joining us today. So my name is Sinman, and I'm from the Smart Nation and Digital Government Office. Hashtag Smart Nation Together is an online platform that is developed to introduce to the community to everything tech, and most importantly, to introduce digital upskilling opportunities for the community. And today, on today's topic, we are currently going to explore the new features of the HealthHub app. And we're very happy to have with us today the team that is part of and doing this application. So they're from IIS. I would like to pass the time on to Jasmine and Jinjen. So Jasmine, over to you. Thank you.
All right, so thank you, Sinman, for the intro. And I have with me Jinjen. Both of us are actually managing HealthHub as product managers. And we're so excited, and thank you for inviting us to actually speak about HealthHub and what have been new in HealthHub recently. So I understand that some of you may have joined us last year when we conducted a training. And during this time, I'm not going to rehash the same thing. I'm going to just share on, what have we been doing since then until now, what's new, and some of the useful features that you might find that it's quite useful to actually share it with your friends or with the seniors out there as well. And I'll just quickly run through a little bit about the company that actually does HealthHub to begin with. IIS, Integrated Healthcare Information Systems. We are the technology agency for the public healthcare sector. Okay, we have won many awards, and we actually, as a healthcare leader, and we actually digitize, we connect, and we analyze Singapore's health ecosystem. All right. At the end of the day, we want to be able to improve Singapore population's health and health administration by integrating intelligent, highly resilient, and cost-effective technologies with processes and people. So we aim to transform healthcare through smart technology. All right, we have about more than 2 million healthcare users out there in the healthcare ecosystem, okay, through many different things. And ultimately, we want to be able to cross boundaries and give you, the user, insights into your own health and to be able to see some of your health records. I'd like to just elaborate a little bit more about our healthcare ecosystem. What I mean by, we are actually connecting our health ecosystem. A lot of people ask this question. There's HealthHub, there's Health Buddy, there's NHG Cares, recently launched end of last year, early this year. And then we have one NUHS app. Why do we need all the healthcare system? All right, so I just like to share a little bit that actually HealthHub, we are the technology providers that provide the means for them to be able to use some of these things that we have at the back end. Okay, so the APIs and everything are being built by us, and then they're reusing those APIs. And also there are some of our features and our pages that when you scroll down to the bottom of it, you'll see the word powered by HealthHub. So all these are actually to make sure that we gain cost of efficiencies in reusing everything that we can to be able to feed a whole ecosystem rather than looking at ourselves in silo. So hopefully that answers some of your questions that I think some of you will have or may have already asked. Okay, so I want to just share a little bit more about HealthHub itself as a product. We understand that it is a national digital front door to an ecosystem of health-related services. Okay, and we actually empower you to be able to view some evidence-based health and wellness information. Okay, assess some of your health records for yourself and loved ones. And just in case you haven't known that actually HealthHub, I can allow you to assess the health records of your loved ones. For example, your parents or your children for that matter. We'll share that a little bit more with you later on in the Caregiver feature. And the other aspect is the ability to perform transactions across the public healthcare institutions. I believe most of you who have actually used HealthHub this year have actually used HealthHub for the purpose of appointment making, perhaps registering for a queue number at a public health institution, making payment, and even medication top up and refill. So these are the few things that we actually have in HealthHub that would actually be able to help you with your health related needs. And while I would like to pause here on this page a little bit, you can see 3 QR codes on the right-hand side. The first you would have seen earlier on, whereby we ask you to download the HealthHub app. The second, in case you didn't know, HealthHub, we are on social media. So we are on TikTok, and that's a very short, good way to actually get updated about some of the new features that we have in HealthHub. All right, and it's like less than 1 minute kind of videos. So I encourage you to go and do it. I know some of you may think, oh, TikTok are for the younger people, but I know quite a number of elderly. They love to scroll through TikTok to see what's happening out there. All right, and the last thing, the last QR code we have is on Telegram. Telegram is also very useful because we actually use that to actually give regular updates to people on what's new or how to take care of your health, wishing everyone, your festivity periods and stuff like that. So please feel free. I'm just going to pause here for a couple of seconds for people to just download that TikTok or Telegram. All right, moving on. So I was requested to do this round of training. After last year, we've done one whole batch of what can you do on HealthHub. We've given you step by step. I'm not going to bore you with the step by step again. I'm going to share with you since then, what have we done on HealthHub? I think the first thing that we've done in November last year is actually to refresh some of our UI items. Okay, and we've actually introduced quick access using biometrics. So I saw a question by Doris earlier on this, and I hope Doris is still around to be able to hear the answer for her question. Okay, and then we've done another release in December, and then in April and in July. So without further ado, I'll share with you a little bit on the refresh UI as well as the quick access. These are quite great features, and I hope you really appreciate them. Many people who haven't gone to HealthHub for a long time, I think a majority of the people I see, 91% of the people have gone into HealthHub this year. So you would have seen the new UI. I hope you have. I hope you like it as much as I have. It's a lot easier to navigate, and it's a centralized place to look for things. Okay, so on the home page, for example, you have all the quick links to all the things that the top 6 services that you usually refer to. And then you can see all the health profiles of your own self, as well as people you take care of. And then the last part, we actually have programs. What are some of the programs that we want to read up a little bit more? On the second tab, which is on the screen on the extreme right, under services. So that is where all the services in HealthHub you will be able to find for yourself under this tab. And then we have the last tab, health profiles. I won't go through them all, but that particular tab allows you to set up your caregiver, which I'll run through with you shortly. So over here, one of the second thing I shared that was very useful in HealthHub was the aspect of quick access or biometrics. I think a lot of us are used to, for example, if I have to sign in SingPass, I'm not sure how many of us have actually forgotten our SingPass passcode. I have forgotten my SingPass password. So one of the things I use is that when I sign in SingPass, for example, I use biometrics because I'm using an Android. But then for iPhone users, you probably use a facial recognition. So what happened in HealthHub in November is that we've actually given you the access of setting up a biometrics. And with that, you will be able to see your next appointment over here on the item 3. Okay, you'll be able to see the health profiles of all the people you take care of. You'll be able to see also your queue registration number. If you click on manage appointments and you go in and then you do registration, you'll be able to see your queue number over here. And we can also go into settings here to be able to take a look at our settings, okay, as and when we want. So what are benefits of quick access? It allows us to actually view some less sensitive information through biometrics or passcode conveniently without the need to log in using SingPass. I think one of the feedback that you guys have given us, which we appreciate your feedback a lot, by the way, and we take it very seriously. So one of the feedback that we've done is that you guys are giving us feedback about SingPass every time it's to log in, very troublesome, and so on and so forth. So we have actually introduced quick access using either biometrics or passcode. So like I mentioned, depending on the device that you're using, if you're using Apple, you'll use Face ID. And if you're using Android, you probably use Thumbprint. So it's set up using the phone's current biometric settings. Okay, and also we have the aspect of using the 6-digit passcode. Over here, I'm just going to share with you very quickly a few steps to be able to enable your biometrics. So first of all, you log into SingPass. And after you log into SingPass, they will actually prompt you, hey, get started. Do you want to get started on using HealthHub? And once you have clicked on that, the next step, step 3 onwards, is whereby they ask you, hey, would you like to enable the setting up of biometrics? With that, they will just bring you to create a 6-digit passcode. Okay, they will ask you to confirm it the second time. And then please note that this passcode is for the purpose of HealthHub and nothing else. So don't link this passcode to any other confidential information that you may have, but let it be a number that you can remember easily. And then you can start setting up the biometrics accordingly. Okay, so whether you will use Face ID or you will use fingerprint, they will actually prompt you accordingly. And then you are being set up. So the first time when you set up your biometrics, you have actually logged in using HealthHub, using SingPass. After you sign in SingPass, you can basically access everything in HealthHub because you've already logged in SingPass. After you log out, after you have closed HealthHub, right, the next time, and then you use it again after you've set up your biometrics, you can only access the 4 features that's on the home page. Anything else that you click to find out more information, you will need to log in using SingPass again. So a common question that will be asked is, are we going to make more features available on HealthHub via biometrics? The answer is yes. We are working out some details to be able to do that. It won't be so soon, but it's definitely something we're working on. Wow, some of us, we click very fast, so when we saw the quick access, we don't know what is it, so we dismissed it. And how to actually access it. So over here, you can have the gear icon, you can click on it, and then you can enable quick access over here. So we hope that you find this useful and that you will be able to use it to be able to use the product a lot faster and easier, the app. Okay, so that was a November release whereby we actually upgraded our UI and actually improved the usability via biometrics. The next features I want to share with you a little bit is in our December release, whereby we've released new health record, which is medical alert and adverse drug reaction. And in April, we have actually refreshed our health profiles user interface and increased lab reports. Okay, so I'm just going to bring you through quickly. So on here, you can see under health records, I will have medical alert and adverse drug reaction or drug allergy. And when I go into it, I will be able to see a report. Okay, so there's 2 parts of it. One part is medical alerts, whereby you will see whether you can have a G6PD deficiency. If you don't know what is G6PD deficiency, chances are that you don't have it. But if you do see an alert over there, you can check out with the doctor, what is this about? Okay, it's basically a genetic disorder whereby when your body doesn't have enough of some G6PD enzyme. So you can ask the doctor a little bit more about what to watch out for. And then over here, we have all the different drug allergies and what are our reactions as a result. We have one of the new features that we've actually done is that we've enabled records to actually be downloaded as a PDF. Okay, and because we've heard from you guys, the users of HealthHub, and a lot of people have been saying, hey, the records are so useful, but for me to do a screen cap one by one, very hard to file. So we've actually started to allow you all to download some of the reports in PDF formats, and we'll continue to do so as we continue to progress and make more records available to you. The next thing that we've done in April this year was actually to release under health profiles. We used to have a My Health booklet over here, and we've refreshed it such that we have enabled all the services to be accessible via your health records, your health profiles link here. If you go and click on your own link, you'll be able to see all the people you take care of and the people who take care of you. And then if you go in and click under your own records, you will be able to see all the different services that are available for you. So basically everything that's on the service tab, you can also access it via the health profiles tab under your own name. In fact, on the health profiles tab, we do have some cards that are open for you so that you can actually glance it very quickly as well as a summary page. So take a look at that. And I'd like to just point your attention because on the services tab, we have about 7 different tabs and things like that. Over here, right, how we managed to put the 7 tabs is we've actually introduced a horizontal scrolling on top. So the first one is on health records, the second is on appointments, and then we've got all the different 7 tabs. So you can do a horizontal scroll on the top, and then at the bottom, you can just tap on it accordingly. So we try and maximize the space, and also we have also increased the font size a little bit to help you all be able to see some of the things better as well. Okay, so over here, I would like to just share a little bit of highlights of what you can do on HealthHub. I'm sure many of you already know appointments and are very familiar with that. So we are able to use HealthHub to view your upcoming appointments over the next 12 months. You're able to manage it in terms of whether you want to view, reschedule, or cancel, depending on whether the institution allows that. And you can also create new appointments subject to the availability of the healthcare institutions. One of the common feedback that we've got from people is, why does appointments in HealthHub, why is it only being released at certain times of the day, or why does it only restrict, me for the next day appointment and so on and so forth? This is very much because the users, or rather the institutions' systems have some limitations, okay? And as such, they've actually allowed such things, and whatever we can use from the system and show it to you, we will just grab it from the system and show it to you. If the slots are available, of course, we'll show it to you. All right, so don't think that we are just trying to play a bit of hide and seek over here, but we're just trying to show you whatever that's available to help make your journey to make an appointment smooth. Okay, there's also the ability in HealthHub to pre-register up to 30 minutes before your medical appointment and obtain a queue number. So again, this is institution specific because depending on their system, whether they can allow you to do a pre-registration. If they don't allow you to pre-register, they will actually have a note there to say that this appointment cannot be pre-registered. You have to register when you reach there at the kiosk. And when you see the queue number, you'll be able to view the number of people before you as well in the queue. And that's also depending on whether the system allows it. And then you can actually get all your visitation and clinic details from there as well. Payments. I see that payments is more and more well utilized these days because people don't like to queue very much. I mean, after you queue to get a queue number, then you queue to see the doctor, and then you queue for make your next appointment. Then you can do one less queue. You'll try and do one less queue, hopefully. This option is to be able to allow you to make online payment for your outstanding hospitalization, outpatient, and or pharmacy bills from all public health institutions. So you can actually view it, you can keep track of it, you can download your bills as well, okay, to make claims from your insurance agents because they have got the logo of the institution in there as well. Payments can be made via Visa or MasterCredit or debit cards and direct debit as well. All right, so we talked a bit about services on the institution side of things. The next thing I'd like to just share a little bit is the aspect of health records. Do you know that health records belong to you because they are your health records? All right, we're not keeping it away from you, but we are making sure that you have access to it anytime you want, and you have the ability to also download them accordingly. So not all are downloadable at this point of time, but we are making it downloadable bit by bit. So earlier on, I shared with you a little bit on medical alert and adverse drug reaction and drug allergies. We also have that included as well for lab test results. Over time, we will make more and more health records accessible in HealthHub, so you can continue to look out for it. Recently in April, we have actually released more lab test results, Previously, we only allowed you to view only hematology and chronic diseases. But now we have got a lot more lab test results. As long as they file it under the general lab test, okay, it will be reflected under lab test results. So hopefully that will be very useful for you. I know a lot of people who have benefited from it, and I've heard how excited they are that in HealthHub, they can actually download it in PDF format to keep a record for themselves. Next, we move on to medications. So a lot of times people like to, earlier on I said you go and you queue up to go and get a queue number, you queue up to make payment, you queue up after that maybe to make appointment, and then the other queue you need to do is sometimes medication, whereby I need to go and get pharmacy medication. Well, did you know that in HealthHub you can actually call a medical refill, request to refill your medication, and then get it delivered to you as well. So you can actually do a medication refill and say that, okay, my prescription is available online. I'd like to refill. Okay, instead of, a doctor give you 6 months, maybe you don't want it to expire. So you take maybe 2 months worth of medication, then you ask them to deliver to you. So that's something that you can actually do in HealthHub today. Another thing that we can actually do is actually appoint a caregiver and grant permission to view your records and perform healthcare related transactions on your behalf. Please note that caregivers must be 21 years old and above. So this is very useful for parents. It's also very useful parents with young children, okay, that you can actually see their records and you can add them as your dependents. And then there's the other aspect whereby working adults, we have got elderly parents at home, and we want to be able to take note of when is their medical appointment and so on and so forth. Maybe they ran out of medication or they need make payment and you want to make payment for them. So this is a part whereby it's very helpful that you can actually appoint, you can ask them to appoint you as a caregiver, and then you can actually view their records, make appointments for them, make payment for them, and so on and so forth. So without further ado, I'll share a little bit on how to actually add caregivers. First of all, we click on the health profiles on the bottom navigation on the right. And then we click under My Caregivers, we click on Show to expand it. And if there are caregivers, you can see who has access to your records. If they don't have access, you can add caregiver. Okay, so this would be maybe if your elderly parents want to grant their children, their working adult children access to their records, they can add them as caregivers. So they will need to have the caregiver NRIC. Okay, please note that this caregiver doesn't only have to be family. It can be a friend as well, because there are a lot of people who are maybe singles out there that actually say that, hey, let's watch out for each other and let's add each other so that we can take care of each other. If you are comfortable to do so, you can allow them access to your records as well. Okay, but you need to know what is their NRIC number, and they also need to know your NRIC number so that they can add you in as well. So after that, you will just enter in their name and email address, okay, and you see what records you want to grant them. So one of the newest thing that we have here, if you see on this screen, there's this HealthierSG. HealthierSG is going to be launched in July. And once this is out, in fact, right now that you have a caregiver and you want your caregiver to help you with your HealthierSG appointments as well, I would encourage you to go into your caregiver and edit the permission to allow them access to HealthierSG. Okay, same thing for medical alert and adverse drug reaction. So any new things that we have, we do not automatically grant the caregiver permission. You will have to access it yourselves, okay, and turn it on, because you need to grant that permission. So once you have looked at it and you say, okay, I've granted all, you just click on next, and then you can proceed with that. And then you'll see this person added as your caregiver. Okay, and once the person has added you in, okay, you have to inform them. And then what happens is that they will then have to add you in by confirming your NRIC numbers. This is just to ensure that your records are not being accessed by somebody else that you don't know, because in case you key in the wrong NRIC number, for example. So this is an example whereby sometimes, your care recipient hasn't given you access to their records yet. Then you will see this error message saying that, sorry, we are not able to process your request. Please ensure your care recipient has added you as a designated caregiver and try again. So that's a very useful feature for a caregiver. And what happens is that after I've granted somebody access to my records, what they need to do is that on the home page, they can click on Add Loved Ones, and then they can say Add Family and Friends. Okay, if you want to add child, you will add child. Definition of child is anyone below 21 years old. Okay, you can only add family and friends if you and the other person is above 21 years old. And then you can add in their, remember I told you, you need to know the NRIC number. So both parties, the care recipient and the caregiver, need to know the NRIC number of each other to confirm that, yes, I know each other, I know you personally. Okay, and then you can start saving them. You can put them any name that you want. You can put them as dad, mom, friend, or whatever it is. Okay, and then you will be able to see their record over here as a parent. Last but not least, I'd like to share a little bit of what we're doing, what we did in what's upcoming in July this year to support HealthierSG. As you know, HealthierSG is something that's on a buzzword this day, and you will be able to enroll in HealthierSG by choosing your preferred clinic on HealthHub. Of course, this is something that's coming. It's not for everyone, and you will receive SMS from MOH to begin with before you can do an enrollment. Otherwise, all of us will see this banner, but if you click on it, it will say that, hey, we'd like to give it to you, but unfortunately, you're not qualified yet. Okay, because we are actually rolling it out bit by bit. So it allows you to, HealthierSG allows you to schedule your first fully subsidized health consultation at your enrolled clinic, and the family doctor will discuss your health goals and medical history and co-develop a personalized health plan with you, okay, recommending your health screening, your immunizations, and some lifestyle adjustments that you need to make. So you can use HealthHub to then subsequently follow up on your health plan from here. So like I mentioned earlier, your caregivers can actually help eligible loved ones to enroll in HealthierSG through HealthHub under Health Profiles. So you can find out a little bit more on healthiersg.gov.sg and also under HealthierSG enroll via HealthHub. All right, this takes me on to the end of my session for today.
Thank you so much to Jasmine and Jinjan for joining us in today's session and sharing all the knowledge that you have on the HealthHub app. I mean, we hear your feedback and we are also happy to share all the good stuff in terms of HealthHub. And also thank you to IMDA for also sharing this session, screening it to more seniors island-wide too. So if you have any questions, please feel free to also check in with us at Smart Nation, and also hopefully we can see you for future sessions. Okay, so thank you so much, and I hope to see you again. Thank you, everyone.
Thank you. Bye-bye.